Patient right and education. Intent of the chapter. The organization has to define the patient and family's rights and responsibilities. Hospital should inform the patient about their rights and educate about their responsibilities at the time of admission. The costs should explained in a clear manner to patients and their family. Hospital has to educate patients, family about how to voice a complaint or suggestions. Main focusing points of patient responsibilities and education. Patients' rights and responsibilities should be displayed in both languages, Hindi and English, at the entrance, lobby of the hospital, OPD registration counter, billing counter, admission counter. Hospital has to identify challenging situations where enhanced communication would be required. For example, breaking the bad news, handling an aggressive patient or family, talking to a family of patient who has expired. Hospital has to define situations of taking consents as per legal requirements. Hospital has to educate about immunization and importance of taking drug at a specific time. Hospital has to provide a tariff list for patient or family. Hospital has to define a mechanism to capture feedback forms of patient or family which include patient satisfaction and experience. Number 1. The organization protects patient and family rights and informs them about their responsibilities during care. Display information material. Communication or counseling should be done in state language or language spoken by the majority of people. The organization, doctors, nurses, and management ensure protection of patient, family rights, and it's also periodically reviewed to address violations, if any. Training programs shall be educated to create awareness among the staff. Violation of patients or family should be recorded. Objective elements. Commitment. Patient and family rights and responsibilities are documented, displayed, and they are made aware of the same. Achievement. Patient and family rights and responsibilities are actively promoted. Core. The organization protects patient and family rights. Core. The organization has a mechanism to report a violation of patient and family rights. Core. Violation of patient and family rights are monitored, analyzed, and corrective or preventive action taken by the top leadership of the organization. Number 2. Patient family rights supports individual beliefs, values, and involves the decision-making process. This could include dietary preferences, worship requirement, and specific requirements following death. Hospital staff shall ensure that patients' privacy and dignity is maintained during their care and any procedure. This includes falling from the bed or trolley due to negligence. Precautions shall be taken especially with respect to vulnerable patients, elderly, neonates, physically challenged, mentally challenged, and patients under anesthesia. Objective elements. Commitment. Patients and family right include respecting values and beliefs, any special preferences, cultural needs, and responding to requests for spiritual needs. Commitment. Patient and family rights include respect for personal dignity and privacy during examination, procedure, and treatment. Commitment. Patient and family rights include protection from neglect or abuse. Core. Patient and family rights include treating patient information as confidential. Commitment. Patient and family rights include the refusal of treatment. Commitment. Patient and patient rights include a right to seek an additional opinion regarding clinical care. Core. Patient and family rights include informed consent before the transfusion of blood and blood components, anesthesia, surgery, initiation of any research protocol, and any other invasive or high-risk procedure or treatment. Commitment. Patient and family rights includes a right to complaint and information on how to voice a complaint. Achievement. Patient and family rights include information on the expected cost of the treatment. Commitment. Patient and family rights include access to their clinical records. Commitment. Patient and family rights include information on the name of the treating doctor, care plan, progress, and information on their health and needs. Commitment. Patient rights include determining what information regarding their care would be provided to self and family. Number 3. Patient or family members are educated to make informed decisions and are involved in the care planning and delivery process. The proposed care should be discussed by the attending doctor with the patient or family members in a language which they can understand. Attending doctor should explain in detail to patient or family members about the expected outcomes of such treatment, possible complications of the treatment, if any are clearly communicated to the patient or family members. Objective elements. Core. The patient and or family members are explained about the proposed care, including the risk, alternatives, and benefits. Commitment. The patient or family members are explained about the expected results. Commitment. The patient or family members are explained about the possible complications. Commitment. The care plan is prepared and modified in consultation with the patient or family members. Commitment. The patient and or family members are informed about the results of diagnostic tests and the diagnosis. Commitment. The patient or family members are explained about any change in the patient's condition in a timely manner. Achievement. The patient or family members are provided multidisciplinary counseling when appropriate. Number 4. A documented procedure for obtaining patient or family's consent exists for informed decision making about their care. General consent for treatment is obtained when the patient enters the organization. The consent shall have the name of the doctor performing the procedure. Consent form shall be in the language that the patient understands. Staff should take in consent before the procedure. At least one witness signing the consent form. Objective elements. Core. The organization obtains informed consent from the patient or family for situations where informed consent is required. Commitment. Informed consent process adheres to statutory norms. Core. Informed consent includes information regarding the procedure, its risks, benefits, alternatives, and as to who will perform the procedures in a language that they can understand. Commitment. The organization describes who can give consent when a patient is incapable of independent decision making and implements the same. Core. Informed consent is taken by the person performing the procedure. Patient and family members have right to information and education about healthcare needs. Staff should educate about safe and effective use of medication and potential side effects of the medications when appropriate. This could also include education regarding the importance of taking a drug at a specific time. Patient and family should be educated about their diet during medication. Patient and family should be educated about their immunization. This could also be done through patient education booklet or leaflet, etc. Patient and family should be educated about their hand washing and avoiding overcrowding near patient. Objective elements. Core. Patient or family are educated in a language and format that they can understand. Commitment. Patient or family are educated about the safe and effective use of medication and the potential side effects of the medication when appropriate. Commitment. Patient or family are educated about food-drug interaction. Commitment. Patient or family are educated about diet and nutrition. Commitment. Patient or family are educated about immunization. Commitment. Patient or family are educated on various pain management techniques when appropriate. Commitment. Patient or family are educated about their specific disease process, complications, and prevention strategies. Commitment. Patient or family are educated about preventing healthcare associated infections. Achievement. The patient or family members' special educational needs are identified and addressed. Number 6. Patient and family have a right to information on expected costs. Hospital has to follow uniform pricing policy for all category of patients. Hospital shall have an updated and transparent tariff list. When patients are shifted from one setting to another, typically to and from ICUs, the financial implications must be clearly conveyed to them. Objective elements. Core. The patient or family members are made aware of the pricing policy in different settings: outpatient, emergency, ICU, and inpatient. Commitment. The relevant tariff list is available to patients. Commitment. The patient or family members are explained about the expected costs. Commitment. Patient or family are informed about the financial implications when there is a change in the care plan. The organization has a mechanism to capture patients' feedback and redress of complaints. The organization shall also capture patients' experience, which may include communication with doctor and nurse, communication about medication, behavior of hospital staff, response of hospital staff, discharge information, pain management, hospital cleanliness. The organization shall incorporate the mechanism for lodging complaints, including verbal or telephonic complaints. The person responsible for the analyzing and action taken. Patient and family members should be educated about how to voice a complaint or give suggestion. All feedback and complaints shall be reviewed or analyzed within a defined time frame. Objective elements. Commitment. The organization has a mechanism to capture feedback from patients, which includes patients' satisfaction. Achievement. The organization has a mechanism to capture patient experience. Core. The organization redress patient complaints as per the defined mechanism. Commitment. Patient or family members are made aware of the procedure for giving feedback or lodging complaints. Commitment. Feedback and complaints are reviewed or analyzed within a defined time frame. Commitment. Corrective or preventive actions are taken based on the analysis where appropriate. The organization shall define a system for effective communication with patient or family members. The organization should detail the components of effective communication for all categories of staff. Hospital has to identify challenging situations where enhanced communication would be required. For example, breaking the bad news, handling an aggressive patient or family, talking to a family or patient who has expired. The staff shall be trained to handle challenging situations as well as in good practices in healthcare communication. The organization shall identify what constitutes unacceptable behavior of staff. For example, abusing patients, hurting the religious or cultural sentiments, communicating with disrespect. The training needs for communication skills can also be identified by analyzing patients' complaints, incident reports, and employee feedback. Objective elements. Commitment. Communication with the patient or families is done effectively. Commitment. The organization shall identify special situations where enhanced communication with patients or families would be required. Commitment. Enhanced communication with the patients or families is done effectively. Commitment. The organization ensures that there is no unacceptable communication. Achievement. The organization has a system to monitor and review the implementation of effective communication. Thank you.